now. And here's how it all unfolded. Cases in China were rising rapidly in the first couple of months of this year. South Korea was next to see a sharp rise. But by the middle of March, the global picture changed. Italy was hit hard, along with Iran and then Spain, and then a huge rise in cases in the US. All these countries were ramping up their testing at these times too.
So 1 million is obviously a huge number and presents an important milestone. But I think what we need to remember is that these are the number of diagnosed cases. And in fact, the unknown of the amount of people that haven't had a test to know they've been infected is obviously likely to be much greater than that. So my worry really is what this means globally, and we're keeping an eye on many other countries around the world, especially, for example, Africa, where some of the case numbers are really beginning to creep up.
We've seen what happens when this virus hits countries with relatively strong health systems. In Europe and the US, medics have been overwhelmed. There are grave concerns about what will happen in countries with far weaker healthcare facilities. South Africa currently has the largest outbreak on the continent, with more than 1,400 known cases. Smaller outbreaks are also underway in countries including Burkina Faso, Cameroon and Senegal. Elsewhere, there is some very early, very cautious optimism. China says it has largely stopped the spread of the disease there, with parts of Wuhan now reopening. South Korea has also seen cases fall in the last couple of weeks. But it's still extremely unclear how this pandemic will play out as cases globally continue to rise. Tulip Mazumdar, BBC News.